So I am Jessica Scotchie, and I am one of the physicians at Tennessee Reproductive Medicine. We began this practice back in 2008 out of a deep love for this field. Dr. Murray and I trained together at Chapel Hill and had the pleasure of becoming good friends and colleagues, and decided that we wanted to expand the services available to patients in the Southeast and Chattanooga. So through a joint venture, worked very hard to open our practice in '08, and have enjoyed watching it grow. And we have the opportunity to help patients who struggle with infertility, who struggle with gynecologic problems like pain and fibroids and endometriosis. My role as a REI doctor with patients, I feel like, is number one, to really make sure that I understand each patient's individual story, to understand how did they get to me that day, what has been their history, what have they tried to do to control their pain or to get pregnant, and then to really make sure that I educate them about their body, what's going on, and what all the different options are, no matter how successful or unsuccessful they may be, so that the patient really feels empowered to make the decision that's right for them and their family. So I think some of the more emotionally difficult things that we see sometimes are when we see very young patients that have come in after years of trying and have often been dismissed by very loving friends and family, but kind of reassuring the patient falsely, unintentionally, that everything's fine because they're young, when in fact, when we see a young patient that's not getting pregnant, it really raises even more red flags that there's likely something wrong, that we could potentially have intervened years ago and really saved this couple a lot of heartache. On the flip side, we often will see older patients that unfortunately don't have the education understanding the reproductive aging process, and have a kind of a false reassurance a lot of times due to what they read in the media about older people having babies, coming in thinking that fertility is still fairly optimal in their late 30s and 40s, when in fact we often are kind of in a time crunch to help them conceive. We really encourage anyone who's tried more than 12 months to seek help, and if you are over 35, to really try to seek help earlier, so that we can have a more expeditious evaluation, which will really help increase the chances sooner.